my name is Sybil Herring. I'm the manager at the Kingwood NICU, and I'm here to show you how to use this piece of equipment. This is called a PANDA warmer. It is made by GE, and it is for the purposes of delivery room resuscitation and stabilization. So we're going to go over the equipment that is on this bed and how you're going to use it. So to start, this is what the bed should look like at all times. You leave it on, it's blinking admit baby. This is giving you a base level of 50% heat, so your bed is warm, and that's extremely important for a stable baby. So your bed is heated, and then all of your equipment here can stay off until the need for resuscitation, but you do want to check it. If you know you have a delivery coming, you need to make sure everything is operational. So we're going to check our bed now. The first thing that I'm going to do is make sure that my oxygen and air are plugged into the wall. So you have your green and yellow plugs over there are telling me that this bed is getting oxygen. I can see them plugged in over there. Okay, so now I'm going to flip on my suction and make sure that is operational. Your suction is actually on this bed attached. There's a suction tubing attached to the back of the bed that remains stationary. This tube right here is attached to the bed. You're going to attach it to your suction canister, and your suction canister has an attached suction tubing up here as well. This suction tubing is going to your first piece of resuscitation equipment, your DeLee catheter. So this is called a DeLee. It is meant for taking the gastric contents out of a baby, which in a brand new baby is amniotic fluid. It can be very thick and prevent the baby from breathing effectively. So you want to use this on pretty much any baby that comes out, unless they come out absolutely screaming in pink, which is rare. Your first line defense, though, is always going to be your bulb syringe. So you make sure you have a bulb syringe in the bed. And now your DeLee is set up. Now I'm going to test the level of suction on my DeLee, because you can be too much or too little. So you want to bend the catheter in half to test your suction, and this is your suction barometer here, and you want it between, 60 is a tiny baby, and 80 is a normal size baby. You can go up to 120 if needed to achieve the suction goals that you're trying to achieve, if you're not getting what you need to get. But again, caution on a small baby. So once I know that my DeLee is working fine, okay, I've got that going for me. Now I am going to test that I have my T-piece resuscitator working properly. So this is a T-piece resuscitator. You should have your bed set up with it already plugged in. It plugs in right down here below the oxygen liters per minute. This little outlet right here. And it comes as this piece here. You have a mask and you have this tube. This piece here is an adjustment dial for the PEEP. So the PEEP is adjusted here and your PIP is adjusted here. So once you plug it in, you're going to adjust your PIP first, peak inspiratory pressure, okay? So this dial here adjusts your PIP, and you want to keep that at a level of 20. You test it and make sure you're at 20 by occluding the mask on your hand, and then you put your finger over the top. Flip it on first. You put your mask on your hand and put your finger over the top. When my finger is on the top, I should get to 20. This is a little high, so I'm going to dial down, and now I'm at 20, okay? So that is your PIP, and now you want to test your PEEP. You get your peak and expiratory pressure, so you test that by occluding on the mask, but not the top, okay? So if I'm occluding on the mask and not the top, I want my PEEP at 5. It is at 5 right now. You can adjust that by dialing this dial right here. And sometimes it takes a lot of turns to get where you need to go, but 5 is where you want it. If your baby requires more pressure than 20 over 5, you can do that. You want to adjust your PEEP or your PIP here, and you can go up to a max of 30 before you hit this little yellow dial here, which is telling you that's a lot of pressure and you're in danger of blowing a pneumo. So be cautious about going over that. But if you push the little dial in, you can go past it, and I can achieve an even higher. But that does put you in yellow and then red. So again, watch that very closely. We want this guy back down to 20 for a proper resuscitation. Okay, so TP's operational, good to go. I start out on 21% oxygen because babies don't need oxygen unless they need oxygen. So that is to say they come out desaturated. They're in the 60s and that is normal. They're going to slowly climb up to the 90s to 100 range, but they're given several minutes to do so. So you want to go by an oxygen guidance chart that is telling you we're at 5 minutes of life, we need to be in the 80s by now. If you're not in the 80s by 5 minutes of life, then you can go up on your oxygen, or at any point you're not achieving what that goal says that you need to be at. The idea there is to only use minimal oxygen because oxygen can cause retinopathy of prematurity in babies, and small babies especially. So that is damage to the eyes, which can cause permanent blindness if too much oxygen is administered. So that's why we watch that. That's the why. Having said that, most babies are going to be okay to use more oxygen on. Resuscitation is obviously your first goal. Okay, so once I know that my suction works, my T-piece works, does my heavier equipment work, does my bag work? I need to use my bag. So again, a mask for your bag. The masks need to be appropriately sized. Depending on the company, they're either going to be a 0, a 1, or a 00. A 1 being a term kiddo and a 00 being a very premature baby. Or they might just say preemie, neonatal, term. They might have those terms too. So make sure you know what you got and what kind of baby you got. You test that by just versus an adult where you're used to this. You need 2 fingers to operate this bag. 2 fingers and I can achieve a pip of 20 on that. So my bag doesn't have a hole. It's plugged into oxygen. I got everything I need. I am ready for resuscitation at this point. Okay, other items that are on my bed: a diaper, because they will pee on you; a hat, because thermoregulation is extremely important in these infants; and 3 blankets. So you want your blankets to be laid out in a triangle pattern like this with the top folded down. The reason why you want them like, and you want 3 of them like this, right on your bed. You want 3 of them like this on your bed because when your baby is born and you put that baby down, the first priority is to dry and stimulate. That's how you're going to make this baby breathe, is by drying and stimulating. You want this baby to cry. So we're rubbing arms, legs, chest, head. We're getting this baby dry. We lift the baby. We throw the blanket. We take the second blanket. We do the same thing. We use all 3 blankets to dry the baby because, again, being dry is going to keep your baby warm, and that's going to keep your baby breathing. A cold baby stops breathing. So once we've done that and our baby is good and dry for our resuscitation, we have all 3 blankets tossed to the side, and you don't need them to swaddle the baby. Your baby is getting an external heat source here. So now that we put the baby on there, we've dried, we've stimulated. Likely we have 2 people. Someone should be using the bulb syringe, your first line of defense for clearing the airway, in the sides of the mouth. So you depress and you insert into the sides of the mouth, never straight into the back where you may vagal the baby. You get what you can from that, but often there are more secretions, especially in a precipitous or fast delivery. Your second line would be your DeLee, which we checked. We know that that's working. So your DeLee has your catheter, your container, and your depressor here. So you want to roughly measure your baby on a term kid. I would say 20. Let's just say 20. That's a safe number. You can stick this down the throat till you get to 20 at the lip, and then depress your button here, and as you pull out, you're depressing this. So as you pull out, you're sucking up secretions from the airway the whole time and getting this. If you're getting a lot, keep going. But stop at 3, because if you continue to do this, your baby can experience a vagal episode and will stop breathing on you. You don't want to do that. So, okay, so now we have, our baby has been suctioned. We know that we're good there, but our baby is still grunting. Let me back up before I get to a full resuscitation. When you cleared your airway, okay, so now we've done airway, we also need to make sure this baby stays warm. As I said, the bed is already warm. But when your baby hits the bed, what you're going to do is press admit baby and APGAR. That's your timer, so the clock is counting now. It starts out in a manual mode. and it's going to beep at you as long as it is in this manual mode and you haven't selected a heat source. You want to put the baby in a baby mode, but to do that you need to attach your temperature probe. Your temperature probe plugs in over here on this side and is labeled with a little baby and a thermometer, so you know where that goes. Once you have that in, you can put it on your baby over a vascular area. I would say aim for the left, lower, right, or left side, over a vascular area, not a bony prominence like ribs, not the spine, down here. That's where we want to put that. So once you get that on your baby, you can switch over to baby mode, and it's going to tell you check temp. The baby is cold. You wave your hand, it's going to stop. But what it's telling you is that you put this on the baby, but you haven't set your temp yet. You want your temp to be 36.5. As a servo temp, it's blinking, it means it's not set. All it's asking you to do is acknowledge that. So once it stops blinking, it's saying, okay, it's set to 36.5. So if your baby gets cold, the bed's going to heat up. If your baby gets warm, the bed's going to cool down. It's going to do what it needs to do, and you don't have to worry about cooking under 100% heat as you're trying to work on this baby. So now I know my temperature is going to be good. I need to work on my baby over here. So all this time we're counting on our APGARs. We measure APGAR scores at 1 minute and 5 minutes of life for a stable baby. If you need more resuscitation, you're going to keep getting APGARs every 5 minutes. So just make sure at 1 and 5 minutes in life you're noting the things that are listed on this form here, which are your appearance. Is your baby pink? Your extremities blue? Is your baby blue? Is your pulse greater than 100, less than 100, or no pulse? And what is your baby doing? An active, vigorous baby is a very happy, stable baby, or you have no movement. We're on this spectrum of life. Respirations, we have a strong cry, slow, irregular, or no breathing. So those are going to be your APGARs. But there's some in-betweens in this. This is just for scoring purposes. Respiratory-wise, you can be breathing, but not stable, and that the baby is either not achieving proper saturations or is grunting. So grunting is like, if you hear your baby doing that, or sometimes people call it singing, it can sound like a sigh, but an audible sound every single time your baby is exhaling is a sign that your baby is trying to open up their lower lobes. So that's where your T-piece resuscitator comes into play. Your T-piece resuscitator can be used for CPAP, continuous positive airway pressure. So for the purposes of CPAP, we put it on the baby's face over the nose. You want to use your little C cup to hold a good suction or a good seal, and you want to depress. Every time you're depressing, you're giving a breath. So I like to say 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. And at that, you're going between 40 and 60 a minute, and which is what you should be achieving. So this is continuous positive airway pressure. We're opening up the baby's lungs. At whatever point the baby stops grunting, you can stop that and discontinue that. This is just to open the baby up. If your baby just needs some blow-by oxygen is achieved by disconnecting this tube from your bag and holding it over the baby's face. Do not leave the bag attached and hold it over the baby's face. This is called a self-inflating bag, and they do not deliver CPAP, or they do not deliver blow-by. A flow-inflating bag or an anesthesia bag that is completely collapsed does deliver CPAP. So again, always got to disconnect on this type of bag. So we're giving some blow-by. Okay. So our babe, that is, we've covered how to use a T-piece, how to give some blow-by, and now we're going to give some breaths to our baby because they're not breathing. A T-piece is what you want to use if your baby is breathing and struggling. This is the safe method, and the point is to not give too much pressure to where you blow a pneumo. This is more used for babies that are not breathing because you're going to have to depress a little bit harder, and it can be a little, because of human error, there is a much greater likelihood that you blow a pneumo with these. So if you can use that, fine. If your baby's not breathing, we go to this. So when we go to this, just like you would use with the T-piece, you do your nice C-hold, and you're depressing and trying to achieve that seal, 1 and 2 and 3, and breathe. That's the 5-minute button. The bed just told me 5 minutes has passed, take an APGAR. I'm going to look at my baby. I'm going to say, okay, this is my appearance, this is my respirations, this is my activity, and I'm going to go off that sheet and give my baby a 5-minute APGAR. That can be done after the fact if you're just making mental notes. Oh, that's what my baby looked like. So again, you're achieving your seal. 1 and 2 and 3 and breathe. 1 and 2 and 3 and breathe. Fingers, not hands. Stay within the green. So that is how you use your bag. And now this bed, this really cool machine, has helped you resuscitate this baby because your baby is warm. Well, this baby's not, he's 31.8, but he's going to be 36.5, which is a good temperature for a baby. And we also have, this particular model doesn't have x-ray capabilities, but you can't, it is big enough to put an x-ray plate, so you can get all the images you need. That's telling me that I need to check my baby. Because the baby's temperature is not within range. So it's saying something's wrong. Likely when that happens, it's because babies they're not very sticky and the probe comes off and it's laying in the bed next to the baby. So when you're talking about oxygen saturations on your baby, we talked about your oxygen probe, which I forgot to put on at the start of this. You want to keep it unplugged because you're going to achieve a number on your screen faster by putting it on the baby first. Where you're going to put it on your baby is your right wrist. You're going to put that on the right wrist of the baby. You're going to line up your little blue dots so they're over each other, and then you can plug it into the machine, and you're going to get a pulse ox, or an oxygen saturation and a heart rate. That does take a while to come up, so don't wait for that number. You're feeling for a heart rate on the umbilical cord. That is the easiest way to get a baby heart rate, aside from a stethoscope you want to count. You can feel the pulsations at the base of the cord, just squeeze it and you will feel your heart rate. And NRP teaches you to tap it out to tell your team what the heart rate is. I would suggest familiarizing yourself with it's 60, we want the heart rate above 60, so if it's 1 beat per second, then you know you're at 60 and you're in some trouble. If you can feel it much faster than that, then you're okay. But to just kind of know where you are, above 60 or below 60, in an immediate resuscitation, that's really all you need to know. So until you can get the monitors working, feel for the cord. Okay, I think that is the basics of these beds. A couple more things I wanted to point out. At the bottom, you have your air and oxygen tank levels, just to make sure that you're checking those from time to time. Operationally using the bed, you don't need to worry about that though. Another thing is this light. There is a light here for the purpose of putting in umbilical lines or intubating with better light. It is very adjustable and it's very bright. Let's see. I think that's it. Your drawers down here are very big, and you should keep many sets of emergency supplies right there in the drawer, because sometimes things fall on the floor, they break. You have plenty of room there, everything you need. And then of course, you want to always have a chucks down or a couple of these for messy deliveries.